I want to go ahead and get started. My name is Kathryn Tucker. I'm a registered dietitian and contractor to the Administration for Community Living. Welcome to the second event in our Food Insecurity Education series. Today's event will focus on the state units on aging, promising practices in food insecurity. Prior to the COVID pandemic, food insecurity was a hot topic within the Aging Network. The Older Americans Act has always included addressing food insecurity among older adults as one of its core intents. And while we had long been aware of the issue, it was not until the pandemic hit that food insecurity finally came to the attention of many others in our country. This realization led to the increased flow of benefits and funding coming into our communities to help us feed those most in need. And we were able to make a lot of progress. However, as we move from a pandemic to an endemic, many of these waivers and funding may go back to the pre-pandemic state. And unfortunately, that does not mean that the problem will disappear. Food insecurity will continue to exist in our communities if it's not addressed. The good news is we have many states who are implementing new strategies to help improve the way that they address food insecurity in the community. Today's webinar will review some of these strategies so that others might learn some successful examples and be inspired to make changes of their own. So next slide. By the end of today's webinar, you will be able to describe components of the food security continuum and how states can identify the levels and need in their communities. Provide examples of successful efforts by state units on aging to combat food insecurity across the Older Americans Act programs, identify possible obstacles to food insecurity efforts and some ways to overcome them, and understand ways the Aging Network can increase partnerships to combat food insecurity. Next slide. Our other speakers today, originally we had Carmen Clutter on board to speak. She had an emergency. She wasn't able to join us, but Trombetta is from Ohio and Ophelia Steppe from New Mexico are going to be with us today. Autumn, if you could take a real quick moment to introduce yourself, and then Ophelia, you can do the same.
Sure. Thanks, Kathryn. Good afternoon, everyone. I'm Trombetta. I am the Population Health and Nutrition Program Manager at Ohio Department of Aging.
Ophelia, I think you're muted.
I'm so sorry. Hello, everyone. My name is Ophelia Steppe. I'm the state nutritionist for New Mexico Aging and Long-Term Services Department. Thank you.
Thank you both so much for being here. I'm excited to hear about your initiatives. Next slide. We have a very diverse audience today, and because of that, I'd like to go over some basics about food insecurity and explain the levels of food insecurity. So let's start with what we know about food insecurity and how it affects older adults. The USDA defines food insecurity as access by all people at all times to enough food for an active life. Food insecurity occurs when the nutritionally adequate and safe foods may not be available. Next slide. We usually talk about two main types of food insecurity. Those experiencing low food security have food, but it's nutritionally inadequate. And this can lead to nutrient deficiencies and malnutrition. Those experiencing very low food security have reduced food availability, and this can lead to skipping meals or not eating. And this type of food insecurity is very serious and will lead to detrimental health conditions. Next slide. While these two general definitions are helpful in giving us a jumping off point for understanding food insecurity, today I'd like to dig a little deeper and start to focus on the true range of experiences and needs that are associated with food insecurity. To do this, I'll be introducing the food insecurity continuum and describing how you can use it as a tool to get a clear picture of what food insecurity looks like in your communities and what action you can take to address it. The food continuum is based on the continuum of care, and the continuum of care is a term often heard in the medical field, and basically it's defined as following a patient over time through health issues without gaps in services. A continuum of care also focuses on consistently following the patient over time to track their changing, evolving needs. The food insecurity continuum is a similar tool, and it can be used to understand that there are ranges of experiences among those facing need. And of course, our continuum does not just contain food insecurity. You'll see food insecurity on one side, and then as you move to the other end, you will see food security, which is complete food security and having adequate food. The goal of any action taken by our program should be to move individuals from food insecurity end to the spectrum to the other end of food security. I do want to note that here the changes in food insecurity status can be temporary. Some food insecurity will be severe and long-term, while others will be short-term and based on circumstances that are not permanent. Either way, it's important to remember that the needs can change and individuals can move up and down the continuum. For example, if Mr. Smith comes into us with severe need, then we need to start by utilizing services within our own programs, maybe providing meals, food boxes, and other services within the Older Americans Act program. This will provide instant help to ensure that he has meals and food. Stage 2, they continue the services, and we can move toward helping to establish additional long-term solutions for his need, such as helping him enroll in additional nutrition programs so he can receive other services. And this can help him maintain his independence. This might mean connecting him with senior farmers market nutrition programs, local food pantries, community kitchens, and even community garden options. Mr. Smith continues to move along the continuum, and continuing on the programs, he has the opportunity to move away from low food insecurity and towards food security. We may refer him to SNAP or other assistance programs if he qualifies, which will help add more programs and add more resources for years to come. Remember, interventions need to be continued for Mr. Smith to become food secure and remain there. Services could change. Mr. Smith may have come in and started off on home delivered meals due to being frail. And however, as he received more services and care, he may now be stronger and able to attend congregate meetings. The food security continuum enables us to design appropriate interventions that meet the specific food insecurity experiences and needs of those we serve, and to recognize those experiences and needs that they may change over time and require adjustments in our programs. Next slide. Those who are food insecure are at greater risk of having poor physical and mental health. And there is a clear relationship between food insecurity and poor health outcomes in older adults, such as decreased functionality, increased risk of multiple chronic diseases. Food insecurity can also lead to malnutrition, which comes with increased risk of hospital readmissions. We also know that the functionality impaired, but we also know that most functionally impaired older adults are not accessing the congregate or the home delivered meals. And this means there's a whole group of people that we need to reach. Our communities are also facing the increased population of older adults and inadequate public funding in order to meet the demands. Next slide. With all of these challenges before us, now more than ever is a time for state units on aging to focus on food insecurity. In their policies, procedures, state plans, and initiatives, when states start focusing on food insecurity, it has the ability to trickle down through the network and make a direct impact on our programs and the people we serve. Area agencies on aging, local providers, and other community-based organizations can look at their policies as well. Let's review our scenario with Mr. Smith earlier. Look around at your congregate sites. Is Mr. Smith there? Was he attending congregate sites pre-pandemic? If he's not, did he start receiving home delivered meals? Do the policies restrict him from getting meals that way? Should the policies be reevaluated or compared to other models to ensure he is able to receive a meal? By making efforts to decrease food insecurity at the state level, SUAs have the opportunity to increase access to the use of Older Americans Act program and services, increase access to and the use of nutrition assistance programs, increase connections to additional food resources, decrease hospital readmissions, and improve overall health, physical health, and the quality of life in older adults. Next slide. We've defined food insecurity and the food security continuum, as well as described the growing need to initiate practices to combat food insecurity. Now let's look at a couple of states. I'm going to talk about a few here, and then we'll move on to our presenters. Next slide. First up is Georgia. Georgia's food insecurity initiative started with changes to their state plan to address food to address the senior hunger. One of the first standalone plans of its kind in the nation. The plan does several things that was directly meant to address food insecurity in the state, including designating a new position for Senior Hunger Nutrition Coordinator and requiring the formation of 12 senior hunger coalitions, one for each of the state's area agencies on aging. These coalitions are provided with $5,000 mini grants each year to support hunger initiatives. Additionally, all nutrition clients in Georgia are screened using the 6-item food security survey that has been standardized across the state. The SUA also hosts, excuse me, an Aging and Disability Resource Connection conference, which includes the Senior Health Initiative sessions that educate attendees on the ways to reduce senior hunger across the state. Next slide. Next up is California. California has a home and community-based senior services senior nutrition infrastructure grant program. That's a lot. The grant allows services to provide modernized kitchens. They purchase needed equipment, vehicles, and other technology to build capacity in order to serve more older adults. The SUA also provides the Older Adults Recovering Resilience funding, which helps to support the older Californians nutrition program so that AAAs can serve more participants. The California's SUA also collects data to help them better understand the needs of their communities, and they partner with a consultant who does an analysis to identify gaps in food assistance for low-income older adults in the state, and they use this information for future work. Some of the stakeholders involved include the California Department of Aging, the Department of Social Services, and California's Association of Food Banks and Meals on Wheels of America. Other partnerships have included other state agencies, such as the Department of Food and Agriculture. AAAs in the state also partner with local food banks, local government agencies like the Department of Housing and Urban Development, and other agencies that specialize in senior resources. The SUA has been collecting older California nutrition program success stories, and they share that through the AAA and through their provider network and stakeholders. These stories are a great way to highlight the impressive work that the AAAs do, the providers are involved in, as well as our clients within the state. Now, I'd like to turn over to our next guest to talk about the work being done in their state to combat food insecurity. First up, Autumn will be sharing some promising practices from the Ohio State Aging. Autumn?
Thank you. Good afternoon to everyone. I'm so happy to be joining ACL and New Mexico Aging and Long-Term Services Department on today's webinar. Thank you to Kathryn Tucker for extending this invitation to Ohio Department of Aging. Again, my name's Autumn Trombetta. I'm a registered dietitian, and I'm the Population Health and Nutrition Program Manager of the Elder Connections Division at Ohio Department of Aging. As Kathryn mentioned, unfortunately, Carmen's unable to attend today, so you'll just be hearing from me. Within our division, we focus on non-Medicaid funded programs and supports for older adults and caregivers, including those supported through the Older Americans Act Title III-C nutrition programs. While brief, I hope to share a little bit with you on what Ohio is doing to promote food security within our aging adults. Next slide, please. So to set the stage a little bit, I wanted to first share some data related to hungry older Ohioans. I'll start with some good news. Food insecurity is trending in the right direction for older Ohioans. In 2019, 12.5% of Ohioans ages 60 and older faced the threat of hunger in the past 12 months. This is a decrease from 13.1% in 2016. With our senior food insecurity rates are average and nationally, you know we won't stop there. Pictured here, you'll see the overall food insecurity for the state of Ohio. This image is not specific to older Ohioans. However, I wanted to show that as a state, we do see a larger disparity in Ohioans experiencing food insecurity that live in rural Ohio and our Appalachian regions. Next slide, please. Data findings from our 2020 summary assessment of older Ohioans suggests the need to address the heart health of our older Ohioans, a condition largely influenced by adequate and sound nutritional intake. On this slide, you'll see that heart disease was the #2 cause of death for Ohioans ages 60 to 74, and the #1 cause of death for Ohioans ages 75 plus. So while Ohio performs similarly to the US overall on several indicators of chronic disease, we do see a notable disparity for both obesity and diabetes prevalence among older Ohioans. Older Ohioans with incomes below $50,000 were more likely to be identified as having obesity than Ohioans with higher incomes. And also, Ohio Medicare fee-for-service beneficiaries who were Black, Hispanic, or Asian Pacific Islander were more likely to be diagnosed with diabetes than white Ohioans. So we have plenty of work to do to address disparities in both food insecurity and our overall health outcomes. Next slide, please. We know malnutrition is a leading cause of morbidity and mortality among older adults, and all older adults are at increased risk. And although food insecurity and malnutrition are different, they are interrelated. Therefore, Ohio has also had a strong emphasis on combating malnutrition also. In late 2016, Ohio Malnutrition Commission was established, and the commission was tasked with developing recommendations to reduce the incidence of malnutrition among older Ohioans. And the commission studied malnutrition as it relates to education and awareness, healthcare costs, data and evaluation, and also prevention models. The commission produced a final report of findings and recommendations in 2018 that you can find on our website, but this final report has really guided our focus ever since. Next slide, please. The Malnutrition Commission report was one of many resources that we used in developing Ohio's Strategic Action Plan on Aging. We call it the SAPA. So the SAPA is a prioritized plan to advance elder justice and equity and achieve optimal health and well-being for older Ohioans. It does include a focus on social determinants of health, such as nutrition and food access. The SAPA also includes a strategy and resource section for each of our prioritized topic areas. And although probably small on your screen, you can see a snapshot here of our strategy sections on improving nutrition for older Ohioans. This section provides a menu of evidence-informed strategies and a list of national and state-based resources that provide additional guidance and information on ways to impact nutritional health for older adults. You can also find that on our website. Next slide, please. So now moving to our Older Americans Act funded senior nutrition programs. We do, I assume like many, require AAAs and or their contracted service providers to conduct nutritional health screenings for all consumers at least once a year. Ohio implements the Determine Your Own Nutrition Health checklist, as you see on your screen. Further, our Ohio Administrative Code encourages the screening to be done in person if possible, because, as you know, it's a prime way to assess the home environment of an older adult. Consumers who screen at nutritional risk, which is a score of 6+, are then referred to providers of home and community-based services like our congregate dining program and or home delivered meal providers, or even contracted dietitians for nutrition counseling. Next slide, please. I'm happy to share a pilot project that we're evaluating currently this year. So in addition to the required Determine Your Own Nutrition Health screening tool, we have one local grantee in Lorain County here in Ohio that will be piloting a food security and social isolation screening tool. This project will identify consumers at risk for social isolation and food insecurity, and then consumers will be referred to local food resources and access points. And so what we did is we took the screening tool, we took 2 items from the USDA's 18-item household food security survey, along with 3 items from the UCLA's loneliness scale. And our goal is to assess the feasibility of adding these additional screening questions and its effectiveness of connecting those at-risk consumers with needed community resources, and maybe catching those consumers that are on the continuum of food insecurity, like Kathryn had mentioned earlier. So this pilot's going to conclude next June of 2023. So we look forward to evaluating and sharing those results. Next slide, please. So I am sure many states can say during COVID-19 pandemic, we, along with our aging service providers, had to quickly respond and adapt services to assure continued food access to our consumers. Here in Ohio, we saw a sharp increase of over 20,000 consumers receiving home delivered meals It was approximately 40,000 consumers in fiscal year 2019, and then over 60,000 in fiscal year 2020. However, new and innovative practices emerged, including grab-and-go meal options, expanded services of grocery shopping assistance and delivery, as well as aging network providers ensuring consumers had access to emergency shelf-stable food boxes in the event their meal services were interrupted or unexpectedly delayed. Additionally, state-supported provider relief funds were extended to adult daycare facilities and senior centers to support reopening of their nutrition services. Many of these providers used funds to upgrade their kitchen amenities or to purchase additional vehicles to support that home-delivered meal capacity. Through amendments to our Senior Farmers Market Nutrition Program, it's SFMNP there on the screen, we expanded program operations to permit the use of bulk purchasing and the assembly and distribution of a mixed variety produce boxes, which were really well received, by the way. And finally, we were proud to launch Ohio's Staying Healthy initiative with CARES Act funding. The initiative focused on Ohio's small business restaurants and providers of home-delivered meals. It was a win-win opportunity to support local restaurants who were heavily impacted during the pandemic while meeting the rising need for home-delivered meals. Many, if not all of these above mentioned services are ongoing still today. Next slide, please. So we know that no one entity alone can combat food insecurity. Ohio is so fortunate to have many strategic partners and collaborations that work toward the same goal. The Ohio Nutrition Incentive Network is a partnership of retailers, producers, state agencies, and local partners, and we collaborate to strengthen Ohio's produce incentive programs. This network is facilitated by Ohio's Nutrition Incentive Program and nonprofit called Produce Perks Midwest. And our Produce Perks doubles the purchasing power for low-income shoppers, providing a dollar-for-dollar match on SNAP purchases of healthy foods. Last year alone, the program served 28,000 SNAP recipients. Another strong statewide group we work closely with is Ohio State Nutrition Action Committee, and this committee is managed through Ohio State University's Extension Office that implements our SNAP Ed program. And they came up with a corresponding marketing campaign called Celebrate Your Plate. Ohio Department of Aging's involvement has led to the inclusion of older adults being featured in some of their testimonials and videos. Another close partner is Ohio Department of Job and Family Services, who's working on the Elderly and Disabled Simplified Application Project. This will allow an extension of the certification period to 36 months, it's currently 24, for SNAP eligibility. We also have a multi-year partnership with the Ohio Department of Rehabilitation and Corrections, which has explored opportunities to invest and support aging well while incarcerated. One of those strategies has been focused on supporting the selection of healthier food options. And finally, we cannot fail to mention our ongoing and strong continued partnerships with our area agencies on aging. We have 12 here in Ohio, and the wide network of dedicated aging service providers. Collaborations with these partners are key to ensuring access to social, nutrition, and economic supports throughout our state, and we are very fortunate to have all of them. Next slide, please. And finally, I'll just conclude with a few resources that we've have found both beneficial and popular in addressing food insecurity and promoting sound nutritional health here in Ohio. In program year 2021, we published Ohio's Eating Well Farmers Market Recipe Book for our Senior Farmers Nutrition Program. And this publication has been used well beyond our Senior Farmers Market Nutrition Program. Most recently, it was distributed at the Ohio State Fair and also our Ohio Wicks Farmers Market that is led out of the Ohio Department of Health. This recipe book features 18 produce-based recipes and health tips, but also includes information on nutrition assistance programs for food insecure Ohioans. We have a variety of languages spoken here in Ohio, and the recipe book was translated into those top 7 non-English languages. All of those can be found on our website, aging.ohio.gov, if you would find them beneficial. Next slide, please. Another recent resource our team developed was the compilation of 12 nutrition fact sheets. Each sheet is focused on consumer-friendly tips and education on sound nutritional health. We focused on nutrition-related topics most relevant, including meeting calcium and vitamin D needs, choosing healthy facts, and reading nutritional food labels. These resources were shared widely with our aging network and have been incorporated into our nutrition education requirements for our Older Americans Act funded nutrition services. They're also available on our website. Shall you find them valuable? So I thank you so much for your time today. I will now turn it over to the exciting work that's happening in New Mexico.
Hello, everyone. Welcome. My name is Ophelia Steppe. I am the New Mexico Aging and Long-Term Services Department State Nutritionist. New Mexico is known as the land of enchantment because of its natural beauty and majestic landscape, diverse culture, 278 days per year that are sunny, and the numerous small farms that can improve the quality and reliability of food for New Mexicans. I would like to share some of New Mexico's initiative programs and funding plans, which will revolutionize the state's food system and reduce hunger and food insecurity by introducing integrated and innovative hunger fighting efforts. Next slide. Let me begin with the New Mexico Food, Farm, and Hunger Initiative, which was passed during the 2022 state legislative session. This initiative is a journal-funded plan that will revolutionize New Mexico's food system and expand effective federal and state nutrition programs, providing healthy meals to thousands of food insecure New Mexicans. This food movement will address immediate hunger relief efforts for food insecure New Mexicans by investing in local producers' ability to support New Mexico's food system and building the capacity of New Mexico's supply chain, such as farmers, vendors, food hubs, ranchers, nutrition professionals, food banks, and many more. The bill includes more than $24 million, which is sufficient to transform New Mexico's food system and economy while also expanding the state food system by providing additional resources for state local agricultural producers to grow more food. The range of programs outlined in the initiatives includes meal gap funding, which will provide food bank assistance to children and older adults in high-need counties experiencing food insecurity. New Mexico Grown in schools, senior centers, and preschools, incorporating local produce, meat, nuts, and other minimally processed food items. Summer and after-school nutrition support to address child food insecurity during the summer months and other times when school meals are not available. The College Food Security Initiative, which will provide food insecure students with grab-and-go healthy meals, low cost or free access to campus during dining plans, campus food pantries, and/or initiatives, and innovations to food distribution systems. Double Up Food Bucks, which provides dollar-for-dollar incentives to SNAP participants to purchase New Mexico grown fruits and vegetables at grocery stores, farmers markets, farm stands, and mobile markets. The Fruit and Vegetable Prescription Program, which provides a weekly vouchers to individuals of rural communities to purchase fruits and vegetables from New Mexico farmers. The Healthy Soils Program seeks to improve the health, yield, and profitability of the state soil. Next slide. In 2020, the department partnered with the University of New Mexico to conduct an older adults needs assessment. The greatest outcome identified from this assessment was that older adults had limited access to nutritious meals and fresh, healthy food. The Aging and Long-Term Services Department determined that the New Mexico Grown Program and senior food boxes would be an excellent investment in the fight against hunger. Next slide, please. One of the agricultural investment initiatives is to expand the New Mexico Grown Program, which connects community meal programs with locally produced goods, which is essential to restoring New Mexico's food system. The vision and focus of the New Mexico Grown Program are to provide nutritious meals containing locally grown, fresh produce and allowable food items for senior nutrition programs, public schools, and early childhood centers, thereby providing both health and economic benefits to low-income communities and local farmers, as well as to foster strong collaboration among state agencies and organizations in order to create a seamless system for integrating local food items into all state nutrition programs. In 2019, the New Mexico Grown Senior Meal Program began a pilot project. The New Mexico legislature allocated $50,000 to the Aging and Long-Term Services Department's New Mexico Grown Pilot Project in 2019. In 3 counties, 15 senior centers served approximately 102,000 meals made with New Mexico grown produce. Among the ingredients in those meals were fresh tomatoes, lettuce from greenhouse grocers, apples, pinto beans, onions, carrots, red and green chili, and blue and yellow cornmeal. In fiscal year 2020, including the mid-March COVID-19 orders, 3 counties served weekly 2,865 curbside pickup meals, 3,295 home delivered meals. In fiscal year 2022, $147,600 state general funds were used to expand the New Mexico Grown Program to 8 aging network providers, allowing 36 senior centers to incorporate locally grown produce in their senior nutrition program. The Food, Farm, and Hunger Initiative is budgeted at $530,000 for fiscal year 2023. 15 aging network providers will incorporate local food items into the nutritional meal programs of 50 senior centers. As a result of the Aging Division's collaboration efforts, now in fiscal year 23, new food items are available for purchase by senior centers, public schools, and early childhood education and care sites. Agencies can now spend 40% of their funding on local meat and 60% on local produce and food items with minimally processing from producers on the New Mexico Farmers Market Association's approved supplier list, which was developed in collaboration with local ranchers, farmers, and vendors, in which these producers have gone through a food safety program with instructors from the New Mexico University Department of Agriculture, a certified GAP, Good Agriculture Practice instructor, value chain coordinators, and a network of certified farmers that have certification of compliance to provide new farmers with technical assistance. Note in the 2021 Aging Long-Term Services State Plan, the goal of expanding services for those who are underserved, the Aging Long-Term Services Department, Adult Protection Services, Aging Network Division, AAAs, and Aging Network providers will collaborate with food banks to expand in-house food pantries and make food boxes available to at-risk older adults and individuals with disabilities, reducing food insecurity to 10.5%. Expand on New Mexico Grown Pilot Project by contracting with 3 additional senior service older American Act providers in fiscal year 22. Increase fruit and vegetable consumption of New Mexicans aged 65 plus to 7.5%, based on the 2021 American Health Rankings, and to include the aging network providers will use up to 3% of their NSIP and Title III C1 and C2 funding to purchase New Mexico grown produce. Some of the challenges that network providers have expressed is the length of time it takes to onboard the farmers as vendors in their financial system. Also, network providers report challenges with staff shortages and vacancy rates, which then requires coordination with the food hubs to break down the produce needed for meals. Next slide. The Aging and Long-Term Services Department has promoted the New Mexico Grown program in a variety of ways, including developing stickers to be placed on the senior meal, grab-and-go bags, and home-delivered meals packaging to inform seniors that their meal contains local food items and that the aging department supports local farmers, ranchers, and vendors in their community. Following that, several poster designs were created for all agencies and public schools to display on walls so that people can learn about types of produce that are grown in their communities, the name of the farmers in their communities, and the best season to purchase a particular fruit and vegetable. Rack cards were also developed as a part of a collaboration effort to be distributed to seniors at events, senior centers, and to home delivered meal recipients. The cards include information about the New Mexico Grown program, as well as contact information for seniors to provide feedback. Next slide, please. The success of these various initiatives has relied heavily on collaboration. Collaboration with the Governor Michelle Lujan Grisham's office, Children's Cabinet, Public Education Department, Early Childhood and Early Care Department, Health and Human Services, the Department of Agriculture, the Department of Health, the Farmers Market Association, the New Mexico State University Cooperative Extension, and the University of New Mexico's Preventative Research Center, who are working on a senior campaign to increase fruit and vegetable consumption. All these agencies and departments make up the Interagency Task Force, which meets weekly and have contributed to the success of the New Mexico Grown program. The New Mexico Grown Coalition Task Force, which meets monthly, is one way the Aging and Long-Term Services Department maintains its network and collaboration. The coalition is a network of public institutions, community-based organizations, and individuals working together to strengthen community food systems across New Mexico. We focus on increasing local food sourcing, expanding garden and nutrition education programs, and strengthening local farmer support. Lastly, we attend the Farmers Market Association's monthly leadership team virtual group meeting, where we discuss food availability, food hub capacity, food quality, increasing the number of small and medium-sized growers and consumers' demand for locally grown food. The department also meets the Aging Network service providers for monthly roundtable discussions in partnership with Farm to Table to focus on program goals, performance measures, strategies, and objectives. Next slide, please. Here are some photos of New Mexico grown producers who are dedicated to supplying fresh, safe produce to our senior centers, public schools, and early childhood care centers. I would also like to highlight how the Anthony Youth Farm provides rural youth with training and leadership opportunities through food farming and business development. Next slide, please. Here are some additional photos of New Mexico grown producers who are dedicated to supplying fresh, safe produce to our senior centers, public schools, and early childhood care centers. Next slide, please. Overall, the New Mexico Grown program is a program that provides equitable access to nutritious and locally grown produce and sourced food, improves meal quality, and provides culturally significant foods, while also honoring farmers and providing economic benefits. Next slide, please. The Senior Food Box Initiative is intended to assist many of our older adults and adults with disabilities who may already receive SNAP benefits and food boxes from food banks on a monthly basis. Yet it is not enough to sustain them throughout the month. They require additional assistance. Many older adults run out of food by the end of the month. So the Aging and Long-Term Services Department will pilot an in-house, non-perishable senior food box program in 5 food desert counties for delivery to homebound older adults or distribution at congregate sites during fiscal year 2023. These senior food boxes will help us expand our ability to provide an expanded resource for many older adults and help seniors fill the meal gap they face each month. To reduce senior hunger and support older adults in living independently in selected rural counties, the Aging and Long-Term Services Department will partner with Adult Protection Services to implement the Rural Food Insecurity Project for older adults. The funding for this project will be utilized for the following: non-perishable food for homebound and underserved seniors in Kathryn County, Chaves, McKinley, Rio Arriba, Harding, and Union County. Every year, New Mexico older adults are impacted by weather-related emergencies. For example, in the northern part of the state, there was a power outage for 5 days. And currently, with all the fires that have ravaged the state, dealing with these emergencies requires collaboration among departments to ensure that food reaches our older adult population. 430 meal boxes were distributed in fiscal year 22 to older adults during the power outage. Collaboration efforts resulted in modified services. During all the fires in New Mexico, the Governor Michelle Lujan Grisham's Children's Cabinet was very quick to work with the New Mexico Food Depot to provide meals in communities so that communities could get additional meals needed. This type of collaboration effort benefits our senior citizens. Next slide, please. I appreciate your time, and if you need any additional information about New Mexico Aging Long-Term Services Department initiatives, please feel free to contact me. Thank you very much. I'd like to turn this over to Kathryn.
Thank you, Ophelia, and thank you, Autumn. It was it's just really good information that can go across our aging network. Next slide. As I mentioned at the beginning of today's presentation, there's always been obstacles to overcoming food insecurity. The ongoing pandemic and our recovery efforts have certainly not alleviated those obstacles. In fact, we now face new and increasing challenges to our work. Let's review a few. As I talk about the obstacles, I will also mention some resources available on the Nutrition and Resource Center page, and those links will be available on the next slide, and I'll tell you, and they'll also be available in the recording. So, to start off with, service providers are overwhelmed by the sheer volume of people in need of support, and these numbers exploded during the pandemic, and they continue to remain high even into the recovery. Therefore, it's important that we strengthen our collaboration efforts within the communities and states, and you can learn more strategies for collaboration during the first webinar in the series, which there'll be a link at the end of this webinar available. And remember that Older Americans Act is not intended to serve everyone, but to focus on those higher in need. A wonderful resource that could be helpful on the Nutrition Resource Center page is Senior Nutrition Program Sustainability and Guide to Prioritizing Clients. The next obstacle, we're also seeing ongoing issues with staffing and recruiting volunteers across our programs, and we've heard that with both speakers. And of course, we're not the only ones affected by this. Finding staff and volunteers is difficult across all organizations and sectors. And while there's no easy solution, looking outside our usual avenues for recruiting volunteers and staff may be useful. I encourage you to read the tips on recruiting and working with volunteers on the Resource Center page. Obtaining meals has also been an obstacle during the pandemic. This was handled through partnerships with new providers. And as you heard, restaurants they benefited from providing meals to seniors during the height of the pandemic when otherwise their doors would be closed. However, as we return to closer normal, in many communities, these restaurant providers are going back to their more profitable margins and looking at the other options and are no longer willing to provide meals to the senior program. Options on contracting meals is a resource available on the resource page as well. Another obstacle is meal prices have increased over the past few years with supply chain issues, transit costs, limited staffing, as well as causing issues with obtaining nutrition providers. You can find a whole list of innovative models available on the resource page. In areas that rely on public transit, this was a new one that we've heard recently, transit authorities may limit the number of bags allowed per person. So if someone is disabled or they are, they're traveling on transit, they can't necessarily carry that many bags with them. So you might want to contact your transit authorities, work out some solutions, let them know what the issues that you face, evaluating your services to see if groceries through the Older Americans Act or grocery delivery options through in-home services may be a referral option. And a final obstacle I'll highlight, and this is a cessation of the multiple sources of supplemental funding, such as CARES, that became available during the pandemic, and our program will need to continue to focus on identifying other avenues of income. On the Nutrition Resource Center page, you'll find a wealth of information on business acumen skills, fundraising, starting a food truck, and working with hospitals. Next slide. So you'll see all of the resources that I talked about are on this page, and they'll be available to you during the recording. Next slide. Over the past couple of years, your resilience and tenacity in making sure the older adults in your community continue to be served have been nothing short of amazing. If any service or program can make a long-lasting impact on nutrition of older adults, I truly believe it's Older Americans Act Senior Nutrition Program. I want to thank our guests and all the SUAs who provided information for this webinar. We know that there are many more states out there that are combating food insecurity every day, and I encourage SUAs to share their work with ACL and the Nutrition Resource Center, and just to help others in our network and inspire them. If you're an SUA looking for ways to get started, you can turn to your Nutrition Resource Center for technical assistance and to help make changes. And with today's presentation, let's start with a few takeaways. If you're just getting started, start small. Look for opportunities in counties that have initiatives and then grow them across the state. It could be as simple as paying attention to your plate waste. If they're not eating the food that you're already serving, then how is that helpful? You may want to look at what you're serving. You could educate local service providers and encourage others to start making small changes. Evaluate the number of meals you provide a day. Some providers serve breakfast and lunch to participants. Other providers may receive local donations to purchase healthy breakfast items for participants who come in early, and they can have a pack of oatmeal before lunch. On a larger scale, review your state's plan and policies to ensure it's addressing food insecurity and promotes nutrition, increased availability of healthy and affordable food in low-income areas. Remember, look at the flexibilities within the Older Americans Act and understand it's not a one-size-fits-all approach. If your state plan and policies allow, your participants can move between programs as their needs change. Do your policies make it harder for those who need it to get services? Don't forget to educate your staff. Let them know the plan and the changes. Food insecurity screening is a wonderful way to identify the range of needs in your state. Be a voice for older adults And it's really needed to ensure that our older population is included in the conversation. Focus on bridging gaps in services by improving partnerships and participation in federal nutrition programs. Collect data and use it to educate the public and key audiences about food insecurity and their communities, as well as solutions through your work and the work of others. Additionally, next slide, we hope that you will participate in future events in our ongoing food insecurity education series. We're aiming at the following topics. So in September, we will continue on with the series on how to identify and screen participants for food insecurity. And in October, we'll discuss identifying referrals for participants who are food insecure. And if you missed it, the recording for the July's webinar, Food Insecurity and Collaboration, is now available on the Nutrition Resource Center page. And today's recording will be there as well. Next slide. Next slide, please. And finally, we did not seek prior approval for this event for the CPU credits for dietitians. You can still receive credit under the CPE activity of 171, teleseminars and webinars. Just visit the CDR website for further instructions. So from there, I would like to open up. I will remind you that there will be a evaluation that you'll receive after the webinar. Please complete that and return that to us so we can make adjustments for future webinar series. And let's open it up for questions. So I want to ask Autumn, this one's for you. How did Ohio fund the creation of the recipe book? So is the nutrition fact sheet shown? Is it standardized training provided across your state?
Thanks, Kathryn. Well, in regards to the recipe book, that was a true collaboration. We internally at the Ohio Department of Aging created the recipes themselves. And then we partnered with Ohio Department of Health, and they funded the translation of those recipe books. And if I'm able, I can share the link in the chat. Otherwise, we can always follow up and get the link to that.
And you can send me that link as well. And if I send anything out afterwards, I can include that too. Okay. The next question is for New Mexico Homegrown Program. How do you address federal and state and local procurement rules giving contracts to lowest bidders?
So for the New Mexico Grown Program, we have an approved supplier list, and that approved supplier list is done through our collaboration with the Farmers Market Association. So all those farmers have to go through a food safety program in order to be on the list. Now, all of our providers that have signed up for the New Mexico Grown Program, they have to use a farmer or vendor that is on that list. And for them to enter in their financial system, they may have to get bids from 3 or 4 different farmers that are on that approved supplier list. Other than that, that's how we deal with the procurement on that. I hope I answered your question okay.
Okay. Is there any other questions? I think we had a few other questions, but most of those were answered already through chat. Let me see. And a link to this webinar will be sent out to the registrants. So you will receive an email with a link to this webinar. And then it'll also be available on the Nutrition Resource Center page at the link within the slides. You'll find that. It's the same link for the last one. Any other questions? Okay. Give a couple other. Are the farmers able to deliver to the senior centers, or do you need a third-party delivery service? Ophelia, I think that's probably for you.
Yeah, that's for me. Yes, they deliver to the senior centers directly.
Do I have any other questions? Okay. If there's not any other questions, then we can end this webinar. I thank everyone for attending, and please look forward to the other webinars in this service. Thank you, Autumn, and thank you, Ophelia, for participating with me today. You all have a wonderful day.